Buenos dias, this is Scott Oliver with CostaRicaHospital.com, here today in Hospital Metropolitano with Dr. Felipe Herrera. Dr. Felipe, thank you very much indeed for spending the time with us today.
You're very welcome.
As I understand it, this hospital is very much a family business because your father's involved, your uncle's involved. How did that happen?
Well, basically, the whole idea started about a year or a little bit over a year ago. We wanted to focus on middle-class people and basically having low-cost surgeries and try to help reduce the cost for patients. So it started out as a family business, and we kind of outgrew ourselves in less than a year. We've had help from big investors recently, which has helped us grow a lot and basically improve in our system. Yeah.
But having said that, although the hospital is a new one, the pedigree of the family behind the hospital is certainly a very experienced one, because if I understand rightly, your father used to be the medical director at Hospital SEMA, didn't he?
Yes. He has a lot of experience with the administrative part of hospitals or big hospitals. Plus, he also had the chance to do his residency program in the U.S. So he's used to kind of working with patients not just from this country, but other countries more like the USA, for example.
Excellent. And give us a sort of summary of where the hospital is located here and what your focus is, what sort of surgeries you're involved with.
Yeah, okay. Basically, the hospital is located in the hospital district. That's what it's called here in downtown San Jose. Mm-hmm. We are in very close proximity to San Juan de Dios, which is a big public hospital, children's hospital, and the geriatric hospital as well. Basically, what we try to do in the surgical part of the hospital is focus on procedures such as plastic surgery, general surgery, for example, cholecystectomies or laparoscopic cholecystectomies. A lot of general surgery and cosmetic surgery as well. But we do a lot of orthopedic surgery, reconstructive surgery as well. So it's basically a lot of different options that you can have here. And we try to focus on procedures which are from medium to low complexity.
Okay, so I mean, when it comes to something incredibly serious where intensive care is needed, that's somewhere else.
Yes, everything that's out of our hands, we try to stabilize it, and basically we don't want to put the patient's life at risk. Mm-hmm. So if it's out of our hands, we stabilize the patient and we send it to a more like a hospital which has the proper intensive care unit or the human staff that can take care of that issue.
Good. And in the brochures that I'm seeing, you do with orthopedics a lot of knee surgeries, hip replacements and hip surgeries, and there's a number of other special clinics you have here. What are they?
Well, we work hand in hand with orthopedic surgeons. Mm-hmm. Anything from knee replacements to hip replacement, fractures. We do a lot of that kind of surgeries as well. Plastic surgery, as I was mentioning before, we have a lot of different outpatient clinics for diabetes, for osteoporosis, metabolism clinics, weight control clinics, which work with different specialists and involve general physicians as well. As I was telling you, we have the ability to have a patient right here in our office and have their lab test in less than 30 minutes, have their x-ray done, their ultrasound done, all in the same building. So it's a lot faster for the patient. It's a lot better for the doctor. Is taking care of the patient because we get a lot of results in before the consult is over.
Excellent. Okay. And if there was something unique that Hospital Metropolitano offers rather than the other hospitals that are here in the San Jose area, what would you say that would be?
Basically, well, you can notice that as soon as you walk in through the doors, that it's still a very type of family business thing. So people will take care of you here like they won't take care of you in any other hospital. It's a very personal relationship between the patient, the doctor, and everyone who gets involved in the process of taking care of that patient. Mm-hmm. Because, well, we've tried to focus on the human part of medicine. That's our main goal. Reducing the risks for the patients, making them feel kind of at home, because we know that a patient comes into the hospital, and as soon as he walks in through the door, their blood pressure goes up to the roof. They start feeling nauseous. They have a headache. I mean, what we try to do is reduce that anxiety, reduce those type of things that patients feel when they walk into a hospital and not knowing what their lab tests are going to be, what the result of their ultrasound is going to be. So we try to basically have a warm kind of atmosphere for them here.
Good, excellent. Now, one of the other doctors we spoke to here in the hospital was talking about one of the differences being that, you know, we don't have fancy fountains in the lobby of the hospital Metropolitano, because they focus on the patients, they focus on quality doctors, and they focus on all the best state-of-the-art equipment, which we've certainly seen, and you'll see some in this video, and that is important. But having said that, if you haven't bought the fountains, what sort of savings could a patient expect to see here compared to CIMA, Biblica, or Católica? I mean, is there a rough general guideline?
Yeah, well, basically, as you were mentioning, Scott, it's as I was telling you, we don't have a fountain in the lobby. We don't have a very fancy hotel-like atmosphere. So what we try to do is focus all of that into the human staff and into the machines we use here. The stress test is the latest machine you can find in the country. We have the GI department with the latest equipment, the OR with the latest towers and lights and everything. So basically what we try to do is focus our finances towards the good of the patient and try not to charge them for a fancy floor in the entrance or a fountain. So basically what we try to focus is on just the general equipment of the hospital that's the best for the patient and the human staff, as I was mentioning before, right?
Excellent. One of the big complaints that we hear on a regular basis about hospitals in Costa Rica is when a patient is inquiring with Nurse Mary or somebody else with regards to a particular price for a particular procedure, is they're given a price, but unfortunately a lot of the time that price is very different than what the patient ends up paying. There could be a significant increase. I'd like to ask you, Dr. Felipe, how is your hospital any different from that? I mean, when somebody asks, okay, well, you know, if I'm going to get a hip replacement or whatever, how can you say with confidence that that's the price that the patient is going to pay?
Okay, so basically when we quote the price for a patient, we have always a study that helps us stand behind the price that we give that patient. I mean, we've done, in the year we've been open, more than 500 surgeries. And that gives us a good idea of basically what exactly is the patient going to need during the surgery, how long it's going to take. So it's not it's very infrequent that a patient needs to get a surprise at the end when it's paying the bill. So basically we talk with the patient before the surgery. We give them a price. We tell them, well, it can go over just a little bit or it can be under that, just to be safe and just to be sure and just to make sure that the patient knows that that's the price he's getting and that's the price that he's going to pay at the end of the procedure, at the end of the consult, or basically at the end of the treatment that he's going to get.
So no big surprises? No
big surprises, definitely not. Cool. No.
All right, so if I understand rightly, Hospital Metropolitano obviously is in an established district in San Jose, the hospital district, which is a superbly convenient location for anybody that's coming to Costa Rica.
Exactly.
You're not investing money in superfluous items like fountains and expensive artwork, which some people are doing, which is still beautiful. You're focusing your monies, your investments on staff, on
equipment,
proper state-of-the-art equipment. And if I understand correctly, a lot of the doctors that are doing surgeries here are in fact the same doctors that are doing surgeries in CIMA, Biblica, and Católica anyway.
Exactly.
Okay, so I mean, all those doctors that your father knew at Hospital CIMA, he still knows and still sees now in the Family Zone Hospital here in Metropolitano.
Yes, sir.
Excellent. Well, I think that sums it up. We're very happy to be here in Hospital Metropolitano. We're hoping to send more business to Dr. Felipe and his associates here. And I'd like to thank you very much indeed for the time.
Thank you, Scott.
Today. You're welcome.
Thank you.